Hello, everyone. My name is Muhannad Alghamdi, and my co-author is Dr. Chua Khan. In this recorded presentation, I will summarize our systemic review titled The Determinant of Low Back Pain. I will briefly cover the global burden, the main determinant domains, and the most important outcome associated with low back pain. Low back pain is a major global health problem and one of the leading causes of youth lived with disability worldwide. It affects hundreds of millions of people each year, and the total number of cases is increasing, mainly due to population growth and population aging. Many projections suggest the global prevalence will rise substantially by 2050. Low back pain is also clearly multifactorial. Determinants span multiple domains, including biological and clinical factors, occupational exposures, psychosocial factor, lifestyle factor, and the broader socio-demographic context. Because these factors interact, systemic review is important to synthesize the evidence and provide structured, integrated understanding. The aim of this study was to systematically identify, classify, and synthesize the determinants and outcome of low back pain. Our specific objective were four. First, to examine the prevalence and epidemiological trends. Second, to identify and classify major determinants domains, occupational, psychosocial, lifestyle, biological, and socio-demographic. Third, to evaluate key outcomes such as functional disability, quality of the life, and economic burden. And finally, to support an integrated biopsychosocial framework for understanding low back pain. This was a systemic review conducting according to PRISMA 2020 guidelines to ensure transparency, reproducibility, and methodological rigor. We saved multiple electronic database using keywords related to low back pain, determinants, risk factor, prevalence, and outcome. We include English language peer-reviewed studies relevant to determinants and outcome of low back pain. The Prisma flow diagram summarizes the process. Studies were identified through database searching, duplicate were removed, then title and abstract were screened. After that, full text were assessed for eligibility and the final set of included studies was compared. After applying the Prisma process, we included 30 studies. The evidence base was diverse, including epidemiological studies, cross-sectional studies, randomized controlled trials, and both systemic and umbrella reviews. The studies represented broad geographic context, global, regional, and national. Population include general adults, older adults, workers in the key industries, and patients with chronic low back pain. Across these studies, determinants were consistently examined within multiple domains, including occupational, psychosocial, lifestyle, biological, sociodemographic, and epidemiological perspective. This slide summarizes the prevalence pattern and the major determinants domains identified in the literature. First, for prevalence, low back pain is a leading cause of disability globally, and it tends to be more common in the older adults and in the females. Second, occupational determinants, physically demanding work, prolonged sitting, heavy lifting, awkward posture, and exposure to vibration are frequently associated with increased risk. Third, psychosocial determinants, fear, avoidance beliefs, pain, catastrophizing, and anxiety and psychological distress are repeatedly linked to higher pain and worse outcome. Fourth, lifestyle determinants. Obesity and high BMI, physical inactivity, and poor sleep quality are common risk amplifiers. Finally, biological and clinical factors. Higher pain intensity, longer duration of symptom, and comorbidities, increasing likelihood of chronicity. Overall, the key message is that these determinants interact and can compound risk. This slide summarizes the major outcome domains associated with low back pain. First, functional disability. Low back pain can impair mobility, reduce workability, and limit daily activities. Second, quality of life. People with low back pain often report reduced physical functioning and poor psychological well-being, especially when symptoms become chronic. Third, work-related outcome. Low back pain is linked with the absenteeism, reduced productivity, and in some cases, long-term work disability. Fourth, economic burden. There are high direct healthcare costs plus indirect costs from lost productivity. Finally, psychological impact. Low back pain is commonly associated with anxiety and depression and with reduced self-efficacy. So the outcome extend beyond pain. They affect function, mental health, and socioeconomic performance. To conclude, low back pain is highly prevalent and remains one of the most disabling conditions worldwide. It is clearly multifactorial influenced by occupational, psychosocial, lifestyle, biological, and sociodemographic factors. These determinants interact dynamically, contributing to chronic pain and function limitation. Low back pain significantly affect quality of life, work ability, and economic productivity. Evidence also highlights that psychosocial factors and workplace exposures can play a central role in the long-term disability. Lifestyle risks such obesity, inactivity, and poor sleep further increase both risk and severity. Therefore, effective management should follow an integrated bio-psychosocial and system-based approach, and multidimensional intervention are essential to reduce disability and improve long-term outcome. Finally, thank you for taking the time to watch this presentation. I truly appreciate your attention. Thank you very much.